So how many people do you have in, at sort of the network that you have?
I have like a community. I just started blogging a few years ago. Like, this is my life, this is my story. And I started writing. I never thought that somebody would ever read my blogs, but then it grew very quickly. And now I have like more than 5,000 people who are following me. And I never thought it was going to be that big for such a small country, maybe not for the States, but for Holland. And from there, it became my business. From there, I started, making events so the parents could come together. And from there, people invite me to come speak for adoption and foster care, and now also more into the government. So I keep my fingers crossed, because that's where I want to be. Right. Share my story there, share my knowledge there. And I just started a few years ago, so I'm still at the beginning. But,
well, it's, as I mentioned, one of the branches of this model that we have is targeted towards non-professional parents or people who work with these kids. And so we have some content that you may find helpful, and I'll talk with Tony and Roland about trying to help you get access to some of that stuff and use in your work.
Yeah, because now I'm also starting to work with funding from the government, because you probably really know, but in the United States you have intensives where you go a few days or a week into a parent's home. Yeah. Because what I think the system is so weird, when I was getting the intense care, you go to a certain office, probably maybe you work the same way too, but you go to an office, strange room, you talk about what went right, what went good, you get tips, and you go home. But for me, it's like, and I did that in the States. I went to Nancy Thomas for a week, and I went with my family to the camp. You get an aid in the 24/7 care. And that's what I do already a little bit in Holland, where I go to families. You need me at 7 in the morning, I'll be there at 7 in the morning. And I look at the whole system. Because very often when everybody is in a room, they talk from their perception. But you have blind spots as a parent. You know, very often parents use way too many words, or not the right words.
Don't say very often. You should say always. Parents always use too many words.
And then you can guide them. We have like signs like that, or we text with the parents, like, you have an emoji like that. So you can guide them almost. Do you know the Super Nanny in England program?
Yeah.
Well, she doesn't have the trauma-informed tools, but that's the way that I work. I have the honor to work with certain families, that you can almost be like the shadow of the mother and look in the family as a system where they are, and then you just observe, and from there you can guide them much better when they're all in the room talking about what went wrong this week.
Exactly. That's very similar to a therapeutic approach called PCIT, where you have a parent and a child that are interacting, playing. Now, it usually is in an office setting.
Yeah.
But the therapist is behind a one-way mirror watching, and then they talk to the parent and they go, you may want to not say so many words now. That kind of thing.
Or use more facial expression. Like some parents, they're like, there's nothing there.
Or they'll try to communicate with their child across the room by yelling.
Exactly. Yeah.
Which is a very common thing. As kids get older, we sort of use those techniques, and we forget that, you really should engage the child, make sure that they're connected to you, and then talk with them. I mean, as I showed before, communication is hard enough, even when you do have somebody's attention. So that's interesting. We've actually moved away from office-based therapy in large part for the reasons you're talking about. We like to do home visits. We like to have people in homes. We like to teach and engage a lot of the people in the child's world, including the teachers and the grandparents. And if everybody kind of has a fundamental understanding, it makes everything so much better.
Yeah. Now, and I ask also the parents, where are your biggest struggle? Oh, when I go with nieces to the play yard, I go with them to the play yard, because how can you solve the problem when you're in an office? I go there, and then you can see what the mother is not seeing, and from there you can guide.
Yeah.
And then, of course, I've been reading all the books. I've been watching all your videos like 100 times, or listening to it to get the right trauma knowledge. But from there, you just have to be practical. And I find, and also a lot of parents that coming to me, they cannot find the practical tools.
Right.
Like how we started the conversation, the lying, the stealing. That I learned also a lot from Nancy Thomas. Do you know this therapy, paradoxic parenting? Well, it's not therapy, but it's a different way of looking at certain things. Like I always tell
a little bit about it. Yeah.
When I talk, like a lot of parents hate it when they scream the most worst things to you. I always tell them, dismantle them like secret weapons. I'm trying to translate now, because you can put so much effort on the screaming, or you can say, oh, you want to do this with your mother, or that's a disease. And then I always, let me see, I have my own attachment monster. I show it to you, because I always want to tell parents, when they show the behavior, it's the attachment monster. It's not the child. And I remember it so well when I was 10, when my daughter was 10 years, I told her, when you acting out, it's not you, it's the attachment monster, het hechtingsmonster. And I saw in my child, so it's not my fault. So that's why I always have this as you could say, metaphor. I always tell them, it's not your child, it's the monster coming out, the attachment monster. And parents love it, because they feel like, I can like take it, the bad behavior, what gives me such a bad feeling, and they feel bad about it, or they have the strong feelings about it. I said, but that's not the authentic child, that's the attachment monster. So that's what I do.
I like that. No, I like it in many ways. It's similar to the psychoeducational thing that we do. We try to help people understand that if there's a overly reactive system in this child's brain, that's what's going to get them in trouble. And it's not that they're a bad person. It's not that they're intending to be impulsive, aggressive. They can't help it. They're reactive. And again, once you can sort of take these interactions and help both the parent and the child understand that this isn't a personal thing. The shame that kids feel after they blow up and they've done something, they feel so shamed, and then that leads to all of these other problems. So again, I think what you're doing to kind of whatever mechanism you can use to help people understand that this is something that is not the substance of the child, and it's not the substance of you as a parent. Because the other thing that, again, I'm sure you run into is that a lot of the parents themselves are struggling.
Oh, yeah.
In the U.S., we do a lot of work, at least in our clinical teams all over. Many of the kids that we serve are in the child welfare system. And probably 90% of their parents were also neglected and abused when they grew up. And so we have these transgenerational challenges where, we're asking, at least a lot of the conventional therapeutic approaches are making the default assumption that the parent is going to be able to think clearly, be on time, use executive functioning, all these other things, when they themselves are a 25-year-old who, was neglected and abused when they were growing up.
Yeah. And
so now we're asking them to parent, and not only parent, but parent an incredibly challenging child. And so if we don't meet the needs of the parents, we rarely succeed with the child. So that's a big part of what we try to do, is recognize that there are multiple, individuals that are involved in this process, and each of them will have needs. And if we can get them all regulated, then they're in a better position to do all these positive things that can happen when people